Welcome to everyone. My name is Bob Carroll, and I'm the vice chair of the caucus. I'm filling in as moderator this evening for our caucus chair, Claudia Reisner, who I think most of you know. She's on vacation. Our guest speaker series this evening features Robin Wilson and Diane Morning Brown from the New Mexico Department of Veterans Services. Robin and Diane will be explaining the PACT Act, which was signed by President Biden this last August and is one of the largest healthcare and benefit expansions in VA history. Diane's also going to go into a couple of the items she would like to go first on, and then we'll get into the PACT Act. For some background on our two guest speakers, we've got Diane Morning Brown as the new director for the Healthcare Coordination Division at the New Mexico Department of Veterans Services. She was raised in an Air Force family, was born in Tripoli, Libya, and lived in Turkey, Italy, and various US states. So she's experienced many cultures. She was a civilian social worker with the Department of Defense, where she worked very closely with veterans and active duty personnel and their families, particularly in placing their loved ones in VA hospitals for short or long-term care. Diane was instrumental in organizing one of the first Alzheimer's units at the Palo Alto VA. Ms. Morning Brown has worked extensively in the Albuquerque community as a member of the city's ADA Council, the Affordable Housing Committee, as secretary of the board of the African American Greater Albuquerque Chamber of Commerce, and she's a member of the Rio Rancho West Mesa NAACP. She is a graduate of the University of Colorado at Boulder with degrees in sociology and journalism. And I think, Diane, I'll go ahead and give a little background on Robin.
Sure.
When she gets here, she can jump right in.
Okay, great.
Robin Wilson is the current director of field services at the Department of Veterans Services, and she's responsible for the 22 veteran service officers throughout the state. She began her career as a first lieutenant in the Air Force, as a critical care nurse stationed at Wilford Hall Medical Center in San Antonio, Texas. She was later deployed to the 332nd Expeditionary Medical Group at the Balad, Iraq Air Force Base. Prior to coming to the Department of Veterans Services, she was a case manager at the Veterans Integration Center in Albuquerque, serving the needs of homeless veterans as well as those struggling with significant substance abuse. Ms. Wilson holds a Master of Social Work from the University of Denver with a concentration in trauma and mental health. So Diane, we'll let you kick it off until Robin gets here. And welcome. I'm glad you could join us this evening.
Great. It's a pleasure to be here. I have been anticipating this meeting for a while. I remember we were up in the legislature in February when we all had our tables out there. And I was talking with Claudia and Tammy and a number of you on doing something on the PACT Act and Veteran Services. So I'm very pleased to be here. Let's see, I can share my screen. Is that correct?
Yes.
All right, let's give it a shot. Okay. Can you all see that?
Yes.
Oh, perfect. Okay, so I am the division director for healthcare coordination at DVS, or Veteran Services. I started there, let's see, about a year and a half ago. And prior to that, I was the director for the Division of Vocational Rehabilitation. So I'm rather, excited to be working in this area, particularly with veterans, which kind of, as you heard, is in my background as well. So There are a number of things about our division, our healthcare division. Oops, let me see. Next slide. Okay. We are not your typical healthcare department or division. We are more of a coordinating, we have more of a coordinating function. So we don't provide direct healthcare, medical care, anything like that. But what we do is develop and coordinate veteran programs and outreach that promote advocacy, resource and referral, which we provide quite a lot of those kinds of referrals, housing, transportation to VA eligible healthcare facilities. And if you didn't know this, in 2019, there was a study that said there were 33.9% of New Mexico veterans that have some sort of disability. So we try to assist as much as possible. We serve sort of like a liaison to the VA on behalf of veterans and their families that have certain needs and issues. We try to advocate for them. So some of our services include, of course, prevention and advocacy. We have a pretty strong suicide prevention and behavioral health component as well. Of course, veteran homelessness. We have a women's veterans program that I don't know if any of you know Teresa Figueroa, but she replaced Robin when she was the coordinator for the women's veteran program. So we have Teresa on board now. And our really big program is the Highly Rural Transportation Program. And we're looking at doing statewide transportation as well. You'll hear more about the transportation because that really is going to play into the PACT Act and getting veterans to and from their initial and subsequent appointments to sign up for the PACT Act. So basically our Highly Rural Transportation Program is a grant from the VA. We cover these 15 counties in green and blue. The counties in green were started in, I believe it was 2021 or 2020. Yes, 2020 initially. And then we got a renewal in 2021, which included these areas in blue. And so then we're currently on our third year for the Highly Rural Transportation Program. And as you see, the white areas are the areas where we do not have funding for transportation to these areas. And I don't know about you all, but I think New Mexico is virtually a rural state. And so we're trying to get funding so that we can cover all of these other areas. We have particularly, increased calls and questions about whether or not we can serve, like Valencia County, for instance, where we know is very rural, and parts of Sandoval, except for Rio Rancho, which, is probably the biggest city in Sandoval. We can't provide services up in this area, the northern piece of that. And of course, McKinley, San Juan, and the Farmington area. So it's, something we're working on very, very diligently. We were able to get some money through the legislature this session. So we will be trying to come up with a plan to provide more services there and throughout the state. I'm sorry. We have currently we had 4 vendors. Now we have 3. So we have one that's based in Clayton in Union County, one that's based in San Miguel, which is in the Las Vegas area, but they serve these other counties, Guadalupe, Debaca, Quay, et cetera. And then we picked up Shuttle Ruidoso in Lincoln County, which serves, of course, Lincoln, Sierra counties. And we just did a contract amendment for them to start providing services in DeBaca and Quay. And they also go into El Paso, Texas. DJ's transportation, we were not able to successfully get those vendors off and running very well, but we are searching for another vendor that could serve Cibola, Catron, Socorro, Torrance, and Hidalgo. So that's kind of where we are in terms of our vendors. DVS does not own any vehicles, and we don't employ any drivers at all either. But hopefully that could change in the future. We're not quite sure. And I see Robin has joined us. Hi, Robin.
Hello, everybody. Thank you for the opportunity to talk to you guys. And I sincerely apologize for being late. I just got back from Taos today.
Okay.
Raton.
Raton. I thought you were in Raton. Okay. And I'm just going to skip down a few slides. As you can see, our veterans are very satisfied with our transportation services in the rural areas. Of course, they always talk about, well, we need more services in, throughout the state, Southeast New Mexico, Northwest, Southwest, and Central. Let's see. This is where we would like to expand. We would love to color in all of the entire state so that we can provide these services. Let's see what else. I'm going to go quickly through here. We also work very closely with the VA, who has a Veteran Transportation Service, which we call VTS, but they primarily serve Albuquerque, Rio Rancho, Edgewood, and Belen. So again, they're serving kind of the metro area, but not to the extent where we really need to, beef it up quite a bit. We also provide funding to the DAV, not for highly rural transportation, but they provide quite a few rides to veterans that live in areas such as Santa Fe and Alamogordo, Farmington, Raton, Las Cruces. And so they have about 11 vans, and they use volunteer drivers. Right now they have between 70 and 75, and most of them, if not all, are veterans, and they retire even, from being a volunteer driver. And then that sometimes causes a lapse in service when they don't have a driver in a particular area. But we've been able to increase DAV funding this year so that they are able to provide more of those rides and kind of take up the slack in the areas that are not highly rural. Let's see. We again, the Veterans Integration Center provides transportation. We work with them. We also work with the New Mexico Rail Runner Express. All veterans can ride free every day on the Rail Runner, and we work closely on marketing and advertising with Marie Mora, who is there at the Rail Runner. Let's see. I spoke very briefly about the Women Veterans program that Teresa Figueroa works with. There are 16,600 women veterans in New Mexico, which is about 11% of the veteran population. So we help them with enrollment with the VA healthcare system, and that is expected to increase by about 27% in the coming years. In the coming year, I would say. Let's see. I think, we have a conference coming up June 10th for the Women's Veteran Program. I think we passed out some of those flyers to you all, so I hope some of you are registered to come. It'll be at the CNM Conference Center on close to where our old office was on Eagle Rock. And we have a number of vendors that will be there, as well as we invited the governor and Mayor Keller from Albuquerque, and we'll have a panel of women generals as well, who will take questions and answers and speak about their experience. I mentioned very briefly about the suicide prevention. Teresa serves as the co-chair of the Governor's Challenge to Prevent Suicide among SMVF, and she's doing a fantastic job with that. We recently received $60,000 from the State Department of Health to help with that, and we're quickly trying to spend $100,000 in a junior bill for homelessness and suicide prevention. So we're excited to be able to provide that. And I think for the good of everything, that is it. This is our healthcare coordination division. We're small, but mighty. Jeremy Anaya is our business operations specialist. So any questions you have about funding or getting paid or anything like that, he's great. And then again, there's Teresa. This is how you can contact her. Connie Vargas is a social worker, but she also mans the transportation line, and that's a separate number for the highly rural transportation grant. So I know I went quickly, but if there's any questions, I'm happy to help.
As we get into the PACT Act, if people have questions, put them in the chat.
Okay.
And we'll, when they finish their presentation, we'll take up the questions at that time. Thanks.
Perfect.
Thanks, Diane.
Thank you. Okay.
And now, Robin, I gave an introduction to you and a brief bio, and I guess you're going to start off with the PACT Act slideshow.
I am. Are you able to put up the slideshow that I sent you, or do I need to pull it up and share my screen?
Well, Ivan has already started it, so there it is.
Thank you, Ivan. So good to see everybody. Again, my apologies for running a little bit late. We did this exact briefing this morning in Raton, and so I've been on the road, and I'm home now, and I won't go in my house because my dogs won't let me give you this briefing. So I'm going to do this from my front patio, and but I'm very happy to be here. So thank you for this opportunity. Again, my name is Robin Wilson. I'm the Division Director of Field Services at the Department of Veteran Services. And the Field Services Division is responsible for our 22 veteran service officers in 16 offices throughout the state. Let's see, we can go to next slide. Do I have the ability? There we go. So PACT Act. We would be remiss in talking about PACT Act without talking about Sergeant First Class Heath Robinson, who enlisted in the Ohio National Guard in 2003. After multiple deployments in Kosovo and Iraq, he returned home and was diagnosed with late-stage lung cancer and an autoimmune disorder that were directly related to burn pit exposure. Unfortunately, Sergeant First Class Robinson did pass away in 2020 at 39 years old from conditions associated with burn pit exposure. So the PACT Act is named in his honor. Next screen, please. Okay, so the name of the PACT Act is the whole name is the Sergeant First Class Heath Robinson Honoring Our Promise to Address Comprehensive Toxics Act, or PACT Act. It was signed into law August of 2022, and the the shorter version, it is the largest piece of legislation from VA benefits since the GI Bill. And so essentially what PACT Act does is it expands the locations associated with radiation exposures. It expands presumptive conditions, and we'll talk about what those are associated with herbicide exposure, which most commonly is Agent Orange. It expands the locations for herbicide exposure, Agent Orange, and then it adds about 20 presumptive conditions to Gulf War veterans from both Persian Gulf War and Iraq and Afghanistan. And then from the VA perspective, it triggers changes to medical exams and requires that all veterans at least be screened for toxic exposure. And one of the things that I am most excited about is it allows an avenue for our surviving spouses to be eligible for our dependency and indemnity compensation claims that result in a veteran's death from something that we can now retroactively relate to PACT Act or toxic exposures. Okay, next slide. Okay, excuse me. So the burn pit presumptive locations, for the most part, it's anything after August 2nd of 1990, which would have been our first Gulf War: Bahrain, Iraq, Kuwait, Oman, Qatar, Saudi Arabia, Somalia, the United Arab Emirates, and the airspaces above any of these locations. And that's what's really unique about PACT Act is that not only did you have to be boots on the ground, which is what the old rule in Vietnam for our Vietnam veterans to get their service connection, but now it covers that airspace above. So if you or a veteran had a job that required flight through the airspace, they are able to get PACT Act service connected for conditions now. And then after September 11th, Afghanistan, Djibouti, Egypt, Jordan, Lebanon, Syria, Uzbekistan, Yemen, and the airspace above these as well. So those are the locations for burn pit exposure presumptives. Next slide. Now, I certainly won't go through every single one of the presumptive conditions for post 9/11 and Gulf War. What I will say is that in general, it's any head and neck cancer, reproductive cancers, and GI cancers, as well as things like chronic sinusitis and rhinitis, things that were attributed to what they call Gulf War syndrome, sarcoidosis, breathing problems, things like that. I would certainly love to pass out the slides to anybody who would like this information. And that way you can go through whether it's talking with your family or talking to other veterans and look at the conditions and let us know if one of these applies. And, we can talk about what the steps for PACT Act would be for you or for the veteran. But these are the illnesses and the cancers that were added as presumptive conditions. A presumptive condition means that no longer do you need to file a claim and then wait to get a medical evaluation at VA and then have that claim adjudicated by VA. What the VA is saying now as a presumptive condition is that if your DD Form 214 shows that you were in Afghanistan in May of 2007 and you have now been diagnosed with a neck cancer, that's all VA needs to go ahead and make that presumptive connection for service connection. You no longer have to go through having a comp and pen exam, which we know can take a long time. So it makes it very easy to get these service connected conditions under presumption passed easily. Next screen. Our Agent Orange presumptive locations. This is very, very big and it's very different. Historically, with our Vietnam veterans, unless they were boots on the ground in Vietnam, they have been denied any Agent Orange exposure. That has now changed with PACT Act. And so it's any U.S. or Royal Thai military base in Thailand from January 9th of 62 through June 30th of 76, anywhere in Laos from December 1st of 65 through September 30th of 69, Cambodia, specifically at Kampong Cham province from April 16th, 69 through April 30th, 69. And then Guam or American Samoa or the territorial waters off of Guam or American Samoa from January 62 through July 30th of 80. And then the Johnston Atoll or a ship that called on the Johnston Atoll from January 1st of 72 through September 30th of 77. These are Agent Orange presumptive locations. That's for Agent Orange, that's the largest change in PACT Act is expanding those areas of operation. And remember, it's if you flew over those areas of operations. And I know with our Vietnam era veterans, the most important thing that I hope I can impress upon everybody is that if they were previously denied any Agent Orange condition because they weren't boots on the ground, please implore them to call us at the Department of Veterans Services so that we can resubmit that claim. And I know that I've gotten the same letter. A lot of veterans have been getting a mass mailing from VA that says you are now eligible for PACT Act, but our veterans are having difficulty because they think once they've been denied once by the VA that letter doesn't apply to them. And the law has changed, which means we can reapply for those benefits. And so again, it's Thailand and Laos, Cambodia, Guam, American Samoa, or the Johnston Atoll. Next slide. Okay. The Agent Orange presumptive conditions, they only added 2 new ones with PACT Act, which is the hypertension and the MGUS, which is a protein deficiency disease. The rest of them have always been what the Agent Orange conditions were, but the 2 new ones are the hypertension and the MGUS. And what I would say with hypertension that makes it so important to our veterans, especially our Vietnam veterans, is that when it comes to our DIC for the surviving spouses, the benefit for surviving spouses, it's important to remember that if a veteran passes away from a service-connected condition or a service-connected condition contributed to their passing, we can get their surviving spouses that benefit. Whether it's healthcare, the state benefits through tax exemptions and things like that, as well as the dependency and indemnity compensation. Okay. Next slide. And then the radiation presumptive locations. They're very limited, but if there is any veteran that any of these 3 areas would qualify for, but they don't have the documentation, we have the ability to contact the DOD and get the records from these areas, especially if it was a TDY or something they went on. So we do have an avenue to help prove that any veteran was in either the, I'm going to say this wrong. I say it wrong every time. The Enewetak Atoll from January 77 through December of 80. The cleanup of the B-52 carrying nuclear weapons that crashed off the coast of Palermo, Spain, January 66 through March of 67. And then the fire on board the B-52 carrying nuclear weapons at Thule Air Force Base in Greenland from January 68 through September of 68. And again, sometimes those records are a little difficult, but we do have an avenue through Department of Defense to get the service treatment records for those 3 locations specifically. Okay, next slide, please. The Service Act. The Service Act is the long name of that is the Dr. Kate Hendricks Thomas Supporting Expanded Review for Veterans in Combat Environment. That's the Service Act. And that was signed into law on June 7th of 22. And what that does is it expands the toxic exposure eligibility for veterans and mammography services. So any veteran that was stationed in Iraq from the same periods, August 2nd of 1990 to February 28th of 91, and March of 23 until burn pits are no longer used. Any Southwest Asia, so Kuwait, Saudi Arabia, Oman, Qatar, August 2nd, 1990, until burn pits are no longer used. And then Afghanistan, Djibouti, Syria, Jordan, Lebanon, and Yemen from September 11th, 2001 until burn pits are no longer used. So VA has not put an end date on that. So anybody who has been stationed in these areas is now eligible for mammography screening, and they're not having to wait until they, necessarily have a condition that would trigger a mammogram. on exam, but they are getting the at least every 2 years screening for mammography. So that's very important. And unfortunately, we did lose Dr. Kate Hendricks Thomas to breast cancer in April of 2022, and that was also related to PACT Act toxic environment. Next screen, please. Okay, the surviving spouse, child, and parent. This is really where Department of Veterans Services can make a great impact. It's that dependency and indemnity compensation payment for surviving spouse, dependent child, or parent of a veteran who passed away from a service-connected disability. And it can be one of three things. It can be the one-time accrued benefits payment eligible if the veteran was owed unpaid benefits at the time of their death. And that happens if a veteran had a claim that the VA hadn't rated yet, and they unfortunately pass away. We can get that benefit passed on to the spouse. They could be eligible for healthcare through CHAMP VA if the veteran passed from a service-connected disability, and then also the burial allowance from VA to help offset funeral costs. The surviving spouse, parent, or child may qualify to receive that if the veteran passed from a service-connected disability. And again, so many times in our office, and I feel like it happens more frequently with our Vietnam veterans, that someone will come in and they will say, my husband or my wife was a veteran and they passed away. I know they were in the military, but I don't know anything else because they didn't talk about their service. And that's okay. We can help recreate records, and we can help navigate through that system and find every benefit that surviving spouse, the child that's a dependent, or a parent, anything that they may be eligible for. We work very hard to make sure that all of those bases are covered and that as much information is recreated or gathered as we can. And we're getting really good at that. Okay, next slide, please. So our veteran service officers, what can we actually do? So we do file the initial claim. We are accredited through the VA in Washington, D.C. We direct submit them to the VA. We assist widows and widowers with pension claims, which are different than compensation claims. We help veterans appeal a denied claim, especially in relation to PACT Act. We can get veterans and their surviving spouses enrolled in VA healthcare if they're eligible, and we can certainly assist in getting or recreating all records. And I feel like, again, with our Vietnam veterans, we all know that there was a fire in the National Archives in the 70s, and that affected about 80% of Air Force and 80% of Army records. Back in the day when they didn't scan them per se, and they were on onion paper, and the records are gone. But we have been able to get enough information and at least partially get 214s recreated so that veterans and their spouses can get the benefits that they are owed. Next slide, please. Okay, so I talked about the offices around the state, and I'm very excited. We've been working very hard to open up additional offices. This year, we opened up our Taos office as well as an office in Berlin. Both of those offices are staffed by an accredited veteran service officer. We just hired another couple VSOs in our Albuquerque office, and we will be reopening our 500 Gold office, which is at that VA regional office in downtown Albuquerque. We've been expanding, and another exciting thing that we're very happy is that we are in the process of creating a mobile unit so that we can use a veteran service officer in a bus type vehicle to go out into our rural and our tribal communities to ensure if you can't get to us, that we can get to you. I know that it's very difficult in our rural areas to rely on internet. Sometimes it's very difficult to rely on cellular service. I know getting phone calls and playing telephone tag is very frustrating. And so we want to ensure that we are doing everything we can to reach our rural and our tribal veterans. We also just started in the reserve area. If anybody's in the reserve area, we have a pilot project at the senior center where we have a computer set up that can do a Teams meeting, a video meeting with our VSO out of the Silver City office any day of the week. And so any veterans in reserve or in that area If you can't get to us, we've set up a secure link so that you can get to your VSO. They have the ability to upload any documents and do everything just like you were in the office with them. We're hoping that that's successful and we can work out a couple of bugs with that. And I would love to have that available throughout the state, more for our rural areas. And we also partner with Aging and Long-Term Services in a interdepartmental pilot project where we have a shared office space in our Union, Harding, and Colfax County once a week, so that veterans in that northeast corner of the state have access as well. So that's what we are doing in terms of our veteran service officers. The best way to get us is our 505-383-2400 number. Again, lots of changes with field services. We now have, instead of that number going directly to a call center and sending out an email, we do now have a live individual who will answer that Monday through Friday from 8 to 5, and then get you connected directly with a veteran service officer or with myself so that we can help you resolve scheduled appointments, check on the status of a claim, anything that you may be looking for, or get you referred to any resources that you're looking for. But that now is a live person and not just an email drop box. And our hope is, we hear our veterans say so many times that it takes so long for us to respond, and we're certainly apologetic. We never want it to take a long time to get back to veterans. But we looked at numbers around the state, and getting about 2,000 phone calls a week, we just needed a little help. So I'm so excited that we have a person now that actually can, answer the phone and give you that information in real time. Next slide, please. And then again, Diane had just talked about the transportation program and the 15 counties that encompasses, and that works with PACT, especially in what the VA has designated as highly rural, because when those appointments come up, or veterans or their surviving spouses are eligible for health care, any VA appointment that may come up, we can assist with transportation to and from those appointments, even if they're overnight appointments. And that's going to be a game changer, especially in our highly rural areas. And next slide, please. Okay. And then again, these are our numbers: transportation program, the veteran service officer, state benefits. Now, I will tell you that any veteran service officer can apply for state benefits for veterans or their surviving spouses. We don't process them, but we certainly have that direct access to submit them. So, Mr. Powell, your question about the depleted uranium, that actually ends up going through the Department of Energy, and we can certainly talk about that. It's not something that we do at Department of Veteran Services, but we have the information for referral to the Department of Energy. I can get that out if you'd like. And then we have we do have our tribal liaison, Beverly Charlie, and we do have our 3 cemeteries in the state, and they are awaiting the confirmation of funding for their 4th one, which would be in Carlsbad. Okay, I do want to address this question that I see in the chat, because it is a very important answer. So, is there any benefit to filing if you are already 100%? The answer to that question is 100% yes, for 2 reasons. Number one, there is a difference between being 100% and being 100% permanent and total. Once you are permanent and total, that means the VA can never come back and reduce potentially your service-connected disability claim. Until you have that permanent and total, or until you go over that 10-year mark, the VA, usually about the 5-year mark, and depending on what the condition is, will send you a letter that says they'd like to reevaluate you. One of 3 things is going to happen. When the VA reevaluates your claim, they're either going to leave it the same and say, yes, you're 100%. They're going to lower it because they're under the impression that you're better, or they could increase it. So until you're permanent and total, that's at the mark where the VA is not going to touch it and come back and want to change it. The other reason that there's a benefit to filing if you're already 100% is that remember, we talked about the dependency indemnity compensation, which is the monthly award to the surviving spouse, child, or parent from a veteran who passes away from a service-connected disability or something that contributed, right? So part of that comes into, we'll make hypertension is the last one that I saw. So a veteran comes in and was able to be service connected for hypertension, but was rated 0. They were already at 100%. So it wasn't going to change their monthly amount, but they did pass away from a stroke that was contributed to their hypertension. So now we were able to get their spouse that DIC monthly award because the hypertension was a contributing factor because it was service connected to the veteran's passing. So that is why, even if you're at 100%, anything that is related to your service and can be service connected, it's so important to claim that. And then the second part of that question is any illnesses linked to the numerous sand lung respiratory illnesses contracted while in theaters. Palo Alto still to conduct business. So I don't know if Palo Alto is still conducting testing necessarily on veterans with Gulf War illnesses. I know that the VA, they have 2 registries. So they have the burn pit registry and they have the Gulf pit registry. You can sign up for both of those either in our office, on the VA website, or at the VA hospital. And what those do is they keep you in touch with research that's going on specifically for conditions related to Gulf War syndrome or burn pits. And then the illnesses linked to sand lung, I'm certainly, again, happy to send out all of the conditions, but I know that when you just start rattling off a bunch of respiratory conditions, they all start sounding alike. And so it would be better if you have a respiratory condition and you were in, one of the areas that is now covered by PACT Act, to give us a call and let's talk about where you were and what your condition is and what it might mean for you. And then next question, could you please describe the current training curriculum and new and current DVA veteran service officers? Oh, so our current training curriculum is we are accredited through, we call it NAC VSO, which is the National Association of County Veteran Service Officers. And we're dual accredited with VA through the Office of General Counsel in Washington, D.C. So our training is their initial training, the first training that all veteran service officers go through is a 40-hour basic benefits training where they learn all about 38 CFR, which is the federal code that regulates compensation and pension claims. Once they pass that final exam and they get that accreditation, they go through background checks with VA and additional training with VA, and then they're accredited and they're able to access VA records and submit directly to VA. Then annually, they're required to maintain 23 hours of continuing education credits, which we get through attending a conference through our accrediting body, NAC VSO, as well as quarterly trainings that we do with VA to keep us on track, especially with PACT Act, with everything that the VBA, which is the Veteran Benefits Administration, everything that they're doing in terms of adjudicating claims, so we make sure there's no miscommunications and that we're on track with what they're learning. And then after that, we have some additional trainings that our VSOs can do. We're very pleased that we now have a certified appeals VSO. That's Arturo Marlowe out of our Las Vegas office. He does the Board of Veteran and Court of Veteran Appeals down in Albuquerque. He sees the entire state, but he went through an additional week of training after you had to be accredited as a VSO for 2 years and do some other things and then go through an additional training. So he's done that. And it's my hope that this year, as some more of our VSOs hit that 2-year mark, that they want to take on the appeals training as well. It's a little bit more difficult and more complex, but that's the training that DVS VSOs go through. Okay. Okay. All right. I think that looks like I've answered everything in the chat. Is there any other questions that I could answer? I would hope that my parting message would be this. This is by no means all of the PACT Act. There's it's a very, very large piece of legislation, and the law is very complex. My hope is that any veteran who is a Vietnam veteran or a Gulf War veteran and they have questions, call us, because we can walk you through that process and ensure that not only you but your family is earning the benefits that you earned. And this is not, the PACT Act doesn't take any benefits away from any other veterans. This is not, and I hear this I've had this conversation with our Vietnam veterans. I don't need it. Somebody else might need it more. If you are a Vietnam or a Gulf War veteran, please come and talk to us. This legislation takes nothing away from anybody, and this is a benefit that you have earned from your service in the United States military, and it would be our humblest honor to help you get these benefits. All right. Well, thank
Robin,
you. Yes,
I have a question. I'm kind of just waking up to this whole PACT Act business. I've never been to the VA hospital. I've served in Vietnam in the Marines, and I've never been to a VA hospital. And if I have some of the conditions that you listed, should I, I do have insurance, but could I get my health care done at the VA for?
Absolutely. So what we would do is we would file what's called a 1010 EZ form, which is a healthcare enrollment form. That form, we can either do it in our office or you can do it at the VA hospital. And so before you are, before your claim is adjudicated as a service-connected claim, they have a means test that they'll do, and they could put you into different categories and determine, what coverage you're eligible for, if you're eligible for VA healthcare. Once you're service-connected, then that treatment can be picked up by VA. And then again, there's about 8 different categories that veterans fall in. I don't like to talk about their categories because I am definitely not the subject matter expert on all 8 of them per se. However, I will say that at a bare minimum, your service-connected disabilities could have a copay depending on what your income is, but I don't see that happening a whole lot. And then if I may, and I know it doesn't really rely around PACT Act, but my previous position was with homeless veterans. And I will say, if you have homeless veterans, their eligibility for VA healthcare is completely different than non-homeless veterans. It's a little more laxed. So, if you encounter veterans or homeless veterans, I always refer them to check their eligibility with the VA hospital.
We have any other questions out there? Nancy, you'll have to unmute yourself. You're on mute. Nancy, you're on mute. And now she's frozen. Okay, why don't we move on to, anyone else have questions that?
I think I unmuted.
Okay, there you go.
You can hear me as long as you don't have to see me. And I'm so sorry I'm late. I've been on the caucus meetings. I don't know. A couple of questions. I'm a nurse here, and I've been involved in behavioral health also in the state, in 32 miles east of Raton. And I'm thinking, wow, I would have liked to have known that you were coming to Raton today, Ms. Wilson. And a couple of my questions, and I might have to catch up, and it's not for today, but I see with the clinics, and you said you're having some of the people that will be settled in Colfax County, that you're not coordinating that with our local veterans clinic. I was wondering about that.
Do you mean the CBOC that's up there?
Yeah, like why wouldn't that have been within the clinic to give out some of the information?
So
that
we
you said-
we do pass all of our information for our invitations. We actually had the VA, both the rural outreach clinic that came with us today, as well as the VA hospital in Albuquerque, the VSO out of Southern Colorado, out of Trinidad, Colorado.
Really? So I'll find out, maybe, I think how I would have definitely been there with you, and how that very important information, maybe I've been having computer problems, but would have loved to help in any way, or I'd love to coordinate with you.
Nancy,
yes.
I can also tell you, if you go on our website, we have a calendar link that's on our website, and that will tell you all of our events and outreaches and where we're going to be throughout the state. If you're interested, you can always sign up to receive our newsletter that also lists where we're going to be.
Yeah.
If you ever just want to send me an email or give me a
call, I will. I will.
Absolutely.
And doesn't it, because you're on the Democratic caucus for the veterans, wouldn't there have been a notice sent out to those of us besides going on the web? Or maybe it went out and I didn't know. Another question. Yeah, that would be helpful. But I know half of it isn't the rocket science, right? And I'm just so glad, because somehow I missed the other meetings, the couple. Anyway, the world is crazy. But the other thing I was looking at with your wonderful, what's going to be given to veterans, I'm not seeing much about the integrated care. Like with every illness, with every loss, the amazing amount of suicide, that I'm not seeing that on those lists, and the behavioral health, which the co-occurring, the integrated
Absolutely.
care.
So I will tell you,
yeah.
and I can certainly give this over to Diane. I can speak about it just a little bit. Again, before I accepted this position as the Director of Field Services, I was the co-chair of the Governor's Challenge. Our governor asked New Mexico to participate in the Governor's Challenge with SAMHSA to prevent suicide in SMVF, which is Service Member, Veteran, and Family.
Yeah.
And so we've been working with SAMHSA all this year to come up with a suicide prevention plan for our entire state and implement that. And you will be seeing more of that coming along. I'm also working very closely with Terry Obago, who keeps track of our tribal suicide initiatives, because we are seeing a couple of our Pueblos, tribes, and nation that are having a slight uptick in veteran suicide. And so we're certainly trying to get more information on that. And we're trying to do it in a way that is responsible and culturally sensitive, and brings in all of the stakeholders. You know, as a very small department, governmental department, we don't have that, but we do have great, partners and stakeholders with Department of Health, with SAMHSA, with VA. We're looping in our state police and our tribal leaders, and trying to do something that's very unique for New Mexico, because New Mexico is very unique in our demographic and our population, and even, our size. So it's.
Yeah. And I am totally with you on this. And all of us are learning, but some of these things and I'm on the 988 commission, and I used to be on the Behavioral Health Planning Council. So we do have some models, and I'd love to work together, which we have always in the past with our local VA. But I think we have little, not because people don't want to work together. We sometimes are in our little quarters. So I would love to, and I'm mostly retired, but I'm still on, different committees. And we are working on exactly the things you were talking about. And I think there's so many good ideas. It's very hard. What we say, around ranch country, right? We really have to get down, excuse my French, to the nut cutting. It's the delivery. So I'm hoping we can set up teams, and I'll give you information, all of you. We're going to have a behavioral health day here by consumers in Raton, June 14th. I'll send you out things started by the advocates. And actually, there's going to be some of the veterans there with an honor guard. And I was just talking to the Liz Gantz of the 988 committee that maybe this day we can use this after it's from 9 to 2. I'll get all your names and numbers to start doing the exact planning on a grassroots level. We have all the, get all the people together. So, I don't know, I don't know much, but, some of being around the block for many years helps. So I just would love to help more if I can.
Thank you,
Great.
Nancy.
Thank you, Nancy.
Nancy, if I could just chime in a little bit, this is Diane.
Sure.
I think perhaps before you came on, I did talk a little bit about behavioral health and particularly suicide prevention, which falls under my division at Veteran Services. Yes. And so there is more information. I'd be happy, to send out information to you. Teresa Figueroa is currently the co-chair, as Robin mentioned, for the Governor's Challenge to prevent suicide. And we recently received money from the State Department of Health to work on this as well. And another probably $50,000 in junior bill funding that was provided.
Right.
Yeah.
I would love to work with you.
Okay, great.
Can
Okay.
you figure out how to share your information then?
I don't know.
between
You see, I'm even off now my picture, which I'm glad. I hate myself on Zoom. I'm so impaired technically, but no,
Yeah.
I have a lot of experience with all that.
Well, if you could put your contact information in the chat or just
I
send
can't even
me.
get on the chat for some reason.
Can you just send me an email?
Yeah, I will.
Okay, great.
And Claudia, I was on the platform committee with Claudia Reiser, and I'm, was involved in local politics and all this. And my father was Battle of the Bulge, but I'm, and since I'm 75, I remember Vietnam.
Sure.
Okay,
absolutely.
You could give me, let's go old school. What was your email?
It is Diane, DIANE morning, MOURNING, like morning.
Like when you're mourning, grieving.
When you're in mourning, correct.
Yeah.
And then Brown, BROWN at DVS .nm.gov as in
Great.
Victor. Okay.
Yeah, you must have Native American. Because of the
Blackfoot from Ohio. Yes.
I love it. And my husband, may he rest, was Cherokee, Irish, English mix. Anyway, I'd love to. And I've been, okay. Sorry to take your time.
We got a couple other questions. Tammy.
Okay, great.
And then Songtree. Tammy, you want to go ahead?
I was just going to let you guys know that you guys are going to be up here in our neck of the woods tomorrow at Cedar Crest or Sandia Park, just up the road. You're going to be at the community center tomorrow from 10 to 2. So if you guys want to stop by there, I'm going to stop by and say hi to you guys.
Absolutely.
Songtree, do you have a question?
Yeah, more like a comment, but it could be taken as a question too. This is all great information. My name's Songtree Payochi. I'm chair of the Native American Caucus, and thank you all for the invitation and this great information about the PACT Act and the changes. And wow, it's a lot of information. My comment is about the lack of transportation in those white counties. What is the plan to expand that? Like, what's
Sure.
the timeline or what efforts are being done?
Well, we've had a plan for probably 6 months or so to expand to those areas. We had requested money from the legislature to be able to provide that transportation in those white areas, those other counties. I think there's 18 out of 33 counties that we're not providing services to. We did get some funding from the legislature for that. So starting July 1, we will try to implement our plan. It won't be as extensive as we had hoped because we, you don't always get what you ask for in terms of funding from the legislature. So that's where you all can help us, though, in terms of making sure that we are able to provide transportation services to the rest of the state, perhaps in the next legislative session. That would be just wonderful if we had much more support for that. So we will let you know as soon as we roll out a plan after July 1.
Great. I look forward to that. I do want to let you know that there has been an increase in transportation services. Maybe I would say in the last 5 to 7 years. I know when my mom first relocated here from California. She was a dialysis patient and there was no services to get them to dialysis. So I had to, bear that burden, which I gladly did, but it would have been helpful to have those. And now I see that there's like little, SUVs going around. One of them says Shema services or Go Lugo Go or something, so I don't know how you guys, the veteran services like operates, like do you contract with many companies like that? So there is places here that are providing. So,
yeah. Now, where are you?
In
Songtree?
San Juan
In
County.
what? Oh, you're in San Juan County.
Yeah.
Oh, great. Okay. Yeah. Unfortunately, we don't have services there yet, but boy, if you could perhaps send me either the names of those shuttles or vans that you're seeing. It is difficult to try to find where all of these service providers are. Currently, we have 4 vendors who provide services, but we certainly do need more. So that would be great if you could just pass those names on to me.
Sure, I would be happy to.
Thank you.
Thank you.
And may I make a comment to Songtree?
Sure.
Yes.
And I would certainly love for you to be able to take this, back to the Native Caucus. This year, I am very passionate in the adage, what we do for one, we do for all. The Department of Veteran Services has a memo of understanding with the Navajo Nation to support and to train their VSOs. I want to offer that to every Pueblo tribe and nation in the state of New Mexico, Southern Colorado, Utah, and Oklahoma with the Fort Sill Reservation, because I think it is very, very important for our Native American veterans to be able to contact a veteran service officer in their community. So, if you want to pass that information along and have anybody who's interested contact me in what that would look like, I certainly have the ability to pay for that initial training that we were talking about with our veteran service officers, loop them into what we do for the state with the quarterly training with VA, as well as our state training that I do with our VSOs to ensure that we're always keeping on track. But in another way, the support also comes in that if you don't know, the veteran service officer is a very, very difficult position in that you're hearing a lot of a lot of emotional trauma all day long. And the average life expectancy for someone in that position, not literal life expectancy, but job life expectancy, is about 2 to 5 years. And then the burnout, kicks in. And so to keep our veteran service officers in New Mexico and to keep them highly trained and to keep them effective, we have to support them. And that also includes our Native American BSOs. And so I want to ensure that when they have questions or when they have, just having those hard days, that they know that we are here to offer, not only mentorship and support and training, but that's very important. And so if you could pass that along, I would appreciate that as well.
I will. Thank you so much.
Diane Guterud, I see you have a question.
Yes, this was a great presentation. Thank you very much. And I met Diane at the legislature last year, and it was I meant to take you out to lunch or get to know you. So hopefully we'll be able to do that.
Sounds good.
My question is completely different than everybody else's. It's really about the homeless veterans. I just wanted to know how do you contact homeless veterans, and do you talk to homeless shelters if they are they sending you information for a mobile unit to come out if they have a homeless veteran to help fill out? And if we meet someone, do we just call you? Because most of them just can't go to the VA. That's my first question. And I was going to ask if we could also have a contact list of all the statewide veteran service officers, the VSOs, but maybe we shouldn't, since they have such a burnout rate. Maybe we just go through you guys. I don't know, but 2 questions.
Well, I think we should probably, even though homelessness is under our healthcare coordination division, Robin is I would say, expert in this arena, because she did actually also work at the Veterans Integration Center. And I think you probably have some very creative ideas in how to contact homeless veterans about their benefits. I think that was the question, right?
Thank you, Diane. Huge passion project of mine is homeless veterans as well. DVS doesn't have a direct homeless program. And so what we have is the referrals. But I can tell you that in Albuquerque, in Alamogordo, in Santa Fe, we do have organizations like the Veterans Integration Center and a couple of others. And we can certainly send out all of the resource information with the nonprofits that deal with homeless veterans and where they're located throughout the state. Who actually, when I was doing it in Albuquerque, I walked, if you know Albuquerque, I walked from Good Shepherd, the library on 7th and Silver, the park, St. Martin's, all the way up to the Rocket Noonday, Albuquerque Healthcare for Homeless, reaching out for any veterans. So in Albuquerque, we do have a pretty good walking system. The VA, every year, they do what's called a PIT count, which is a point in time count, where they go out and they try to find homeless veterans to count. Because New Mexico is as rural as it is and as large as it is, it doesn't work super well because we're not able to get out into every community. So I think that number is a little bit underrepresented. What I would say is, not to put everything on the Veterans Integration Center, but they do have their office in Albuquerque, and that has their supportive services for veterans families and their transitional housing program, as well as an office in Alamogordo, and they cover the entire state. They will literally drive anywhere in the state to pick up a veteran and their family and put them in either a hotel for, a week or so until some housing arrangements can be made, or get them involved in their transitional housing program, which would house them for up to 9 months to a year in a campus where their whole family could be together until we could work on some other what is that root cause of homelessness, right? We all know that you cannot take a homeless person, just put them into a place and not address any of the kind of social service concerns and expect that they do well. We end up having, I refer to that as the circle of homelessness. We get somebody housed. We didn't address the root cause of the homelessness, whether it was, needing to get reengaged with VA healthcare or needing financial management courses or getting them service connected or, talking about mental health concerns like post-traumatic stress, and then they fall out. We also have HUD-VASH. HUD-VASH, if you aren't aware, is a program through VA and through HUD. And so most areas throughout the state have what are called HUD-VASH vouchers. Those are Section 8 vouchers specifically for veterans. I say most because not every community has them. And Alamogordo, I know for a fact, does not have any. And that's because their HUD office in Alamogordo doesn't want to do the case management component of a HUD-VASH voucher. So I would say 98% of all of New Mexico has the ability to have HUD-VASH vouchers, but not all of them. So there are opportunities, supportive services for veterans families. There's additional wraparound services. We have the Goodwill, we have the Veterans Integration Center. We have a whole list of nonprofit organizations that work specifically with veteran homelessness that we are more than happy to get out to everybody, so that if you hear of a veteran in let's say you're in Gallup and you hear of somebody in Hobbs, you could look and say, oh, I know who covers Hobbs and I know how to get that information. We've been working on that, Diane, for about 7 months. We've been putting that list together. Our difficulty, so it's not our VSO burnout. That's not the burnout. Our VSOs love helping our veterans. I think our burnout, where our wheels spun a little bit, for a good probably 6-7 months, is trying to figure out, after everybody came back from COVID, who was doing what. Offices moved, offices closed, people left position, contact numbers changed. And so just kind of getting all of the stakeholders in the state back together and say, okay, who are you guys still doing this? Are you still doing that? Are you still located here? And trying to figure out, kind of all of that information has been our biggest, I would say, hurdle. We are planning, our cabinet secretary is very passionate about having a service provider conference at the end of summer, so that all organizations and nonprofits and state entities that have some type of veterans program can come together and we can share information about what we're doing, and again, get everybody back on track. Diane and I have talked and presented a plan where interactive resource material would be available on our website. We are talking to our cabinet secretary and our IT people about what that would look like. So we have plans for things that would be easier for the community to use to address things like homelessness and benefits and information. But Diane, let's see, you've been in your position a little over a year, and I've been in my position a little under a year. So a little
Right.
mercy and grace.
That's right.
Thank you.
Okay, do we have anybody else that has questions?
Sorry.
Well, if not, we can go ahead and shut it down. Thank you so much. I really, and we give them a big hand, because that's really great information that you guys have come back with. And it's so difficult, I think, for a lot of veterans to even wrap their minds around the whole thing. And it's difficult to know what's out there, but you guys are really, contributing, I think, and, providing people with information and services. So thank you very much. And thanks very much for being here this evening. And I think that's it.
Thank you so
Great.
much. And again,
Okay.
Thanks for having
please
us.
call with
Thank
any
you.
questions.
Okay.
Please
Thanks
do.
a lot, Robin.
All right. Bye.
right.
Thank you.
Good night.